When you start looking at Medicare options, it can seem overwhelming. Today we're going to break down Medicare supplements so you know exactly what you're looking at when you see something like this. You will also learn how to figure out which of the alphabet soup here is the best option for you if you choose a Medicare supplement for your health coverage. What are Medicare supplements? Medicare supplements, also known as Medigap plans, are insurance policies that fill in the gaps that would otherwise be your out-of-pocket costs with original Medicare Parts A and B. Medicare Parts A and B are your primary insurance coverage. If you have a covered medical expense, Medicare pays its responsibility first, then your Medicare supplement pays based on the plan's benefits. Medicare supplements are much older than Medicare Advantage plans and Medicare Part D plans and have different laws and regulations governing them. Why would you choose a Medicare supplement for your coverage? If you have a Medicare supplement, you don't have to worry about provider networks because if you have a standard Medicare supplement, there are no provider networks. You are free to see any medical provider who accepts original Medicare. This makes Medicare supplements popular with people who don't want their choice of medical providers restricted by an insurance company. You also don't have to worry about benefit changes. Insurance companies can't make any benefit changes to Medicare supplement plans. These plans are standardized by law, so the only time benefits change is when a new law changes Medicare supplement benefits across all companies. Also, there's no need to take time to compare Medicare supplements during the annual enrollment period between October 15th and December 7th. Medicare supplements are not affected by the annual enrollment period at all. They are month-to-month contracts that you can change at any time during the calendar year. The rules for changing Medicare supplements do vary from state to state and can depend on your health and how long you've been on Medicare. If you are beyond your first 6 months on Medicare Part B and don't have a guaranteed issue right, you will have to answer health questions and go through underwriting to be able to purchase a new policy. For most people, that isn't a barrier to changing. More information on Medicare supplement underwriting can be found in the video linked above. Back to the chart. It looks like there are a ton of different Medicare supplements. That's a little misleading. Medigap companies have to offer Plan A, and beyond that, each company chooses which other plans to market in each state. Some of the plan designs don't make much sense financially for Medicare beneficiaries, so few insurance companies even offer them. That's the case with B, D, K, L, and M. Also, plans F and C are only options for people whose Medicare effective dates were before January 1st, 2020. Even if you have been on Medicare long enough to be eligible to purchase a Plan F, it's not a good idea. More on why that is in the video linked above. After those eliminations, the plans that offer the best value for consumers are Plan G, Plan N, and High Deductible Plan G. Let's look at each of these in detail. Plan G is the most comprehensive Medicare supplement of the three. For all medical care covered by Medicare Parts A and B, your out-of-pocket risk with a Plan G is limited to the Medicare Part B annual deductible, which in 2023 is $226. All outpatient expenses beyond that are covered between Medicare Part B and Medigap Plan G at no cost to you. This includes things like office visits, diagnostic testing, and all outpatient treatments. On the inpatient side, all covered expenses are split between Medicare Part A and Medigap Plan G. You have no out-of-pocket deductible for inpatient care. Because Plan G has the most coverage with the least amount of out-of-pocket risk for you, it is the most expensive of these three Medicare supplement options. Since Medicare supplement prices generally go up every year as you age, we need to think about future costs in addition to the price you pay when you first apply. Plan G is more expensive when you first enroll, and you can expect yearly premium increases to be more with a Plan G than with a Plan N or a high deductible Plan G. Who should consider Medigap Plan G? If you have very expensive ongoing treatments like chemotherapy, treatment for rheumatoid arthritis, or any other medical condition that requires regular or costly care, a Plan G can be a good choice for you. The higher Plan G monthly premium is balanced out by the savings on out-of-pocket costs because you don't have a big deductible to meet or any copays. At the opposite end of the coverage spectrum, we have high deductible Plan G. This Medicare supplement provides exactly the same coverage as regular Plan G with one big difference. You have to meet a high deductible before high deductible Plan G will pay anything. In 2023, that deductible is $2,700. If you have a high deductible Plan G, you will pay the Medicare Part A and B deductibles, copays, and coinsurance up to $2,700. If you reach that amount in your spending, then the Medicare supplement kicks in and pays just like a regular Plan G. Because this plan has the least amount of coverage and the biggest out-of-pocket risk for you, it also has the lowest monthly premium cost. High deductible Plan G also has the smallest premium increases every year. Who's an ideal candidate for a high deductible Plan G? If you are healthy and don't need much medical care, this can be a great way to protect yourself from catastrophic medical bills while saving a ton of money on monthly Medicare supplement premium costs. In many parts of the country, the difference in premium between a regular Medicare supplement Plan G and a high deductible Plan G is well over $100 per month. Why not just have original Medicare Parts A and B? Do you really need a Medicare supplement? Medicare Parts A and B have no out-of-pocket spending limit for beneficiaries. If you only have Medicare Parts A and B, there is no limit to how much you can spend on your medical care during the course of a year. A high deductible Plan G provides a cap on how much you can spend out of pocket during a year, and if you have a serious illness or injury, you have the assurance that your spending, in addition to the monthly premium costs, is capped at $2,700 for the year. Then in the middle of the coverage options, we have Medigap Plan N. This is a newer Medicare supplement plan, and it grows in popularity every year. It is like Plan G, but slightly less comprehensive. There are two differences between Plan G and Plan N. Both are in the outpatient coverage. Inpatient coverage is identical between Medigap Plan G and Medigap Plan N. One difference is that Medicare Part B excess charges are not covered by Medigap Plan N. In most cases, that's not a big concern. The only time you can be billed an excess charge is if you see a doctor who contracts with Medicare as a non-participating provider. Only about 4% of Medicare providers contract as non-participating providers. A non-participating provider accepts Medicare patients, but doesn't accept Medicare payment as payment in full, and can balance bill patients up to 15% more as an excess charge. To find out how your providers are contracted with Medicare, you can use the Physician Compare tool at Medicare.gov. Of course, the easiest way to avoid excess charges is to only see providers who are contracted with Medicare as participating providers. If you must use a non-participating Medicare provider, here's how often you can expect excess charges to show up on your bill. A few years ago, one of our Medicare supplement insurance companies looked at all their claims for a calendar year and found that 99.34% of those claims had no excess charges. Of the 0.66% of claims that did have excess charges, the average cost of an excess charge was under $20. Excess charges are very rare and they aren't automatic even if you're seeing a non-participating provider. The provider can decide whether to balance bill a patient on a case-by-case basis, and the amount is not always an extra 15%. The rule is the excess charge can be up to 15%, so it can also be less. The risk of excess charges is so low that paying extra just for a Medicare supplement plan that covers them doesn't generally make sense. The other difference between G and N is that with N, after meeting your Medicare Part B annual deductible, you may have copays for office visits of up to $20 and for ER visits of up to $50, though the ER copay is waived if you're admitted as an inpatient. These office visit copays are not necessarily charged at every office visit. It depends on how your visit is coded by your doctor's office. So it isn't guaranteed that you will have to pay a copay for an office visit, but if you do, that amount is capped at $20. Because Plan N has middle-of-the-road coverage between Medicare Supplement Plan G and High Deductible Plan G, it also has middle-of-the-road premium costs. If you're trying to decide between a Plan G and a Plan N, look at the difference in the premium cost between the two plans in your zip code and how many office visit copays you are likely to pay in a year. Premiums vary widely from one state to another. Here are a couple quick examples from rates in Illinois. For a male age 70, a Plan N has a premium savings of around $35 a month versus a Plan G, for a total of $420 per year. If he makes fewer than 20 office visits per year, the Plan N is the better value. For a female age 70, a Plan N has a premium savings of about $30 per month over a Plan G, for an annual savings of $360. If she makes fewer than 18 office visits per year, the Plan N is the better value. Remember, there are also future costs to consider when choosing a Medicare supplement. Because Plan N has slightly more out-of-pocket risk for policyholders, the rates increase more slowly than Plan G premiums. Once you've decided on the Medicare supplement plan that has the right amount of coverage for you, it's time to comparison shop all the companies that offer that plan in your zip code. Although the coverage is standardized by law, the costs from company to company for the exact same plan can be wildly different. Different companies use different pricing models. So it is really important to do research and detailed comparison shopping before you apply. It can save you a lot of money initially and in years to come. This is what we do for all of our clients as Medicare plan brokers. We work with many insurance companies and can impartially comparison shop all of them with you to find the plan and the company that best fits your needs. We do this completely free of charge for our clients. We're able to do that because for every enrollment in a Medicare plan through our office, we are paid a commission by an insurance company. The commissions are very similar across plans and insurance companies, so we have no reason to push one company over another for our own gain. We are free to find the plan and the company that fits each client's medical and financial situation best. The Medicare plan cost to you is the same whether you purchase direct with an insurance company or through a Medicare plan broker. Once you are a client of ours, you have ongoing free access to expert help whenever you have a question or when premiums or plans change and you need to think about switching Medicare plans. If you have Medicare supplement questions, please feel free to give our office a call at 877-312-1414 or use the link in the description to reserve a free, no obligation Medicare plan consultation. We're here to help you understand your options and find the best Medicare plan for you. Have a great day.